want to move on now to the second panel, which is folks who can talk to us about the impact of COVID-19 on the prison community, both inside and outside the facilities. Let's turn to James King from the Ella Baker Center.
Good morning. Thanks to the chair and members of the committee for allowing me to speak with you today. My name is James King. I was released from San Quentin 6 months ago after living there for 6.5 years. During my time there, quarantines were routine. No matter how often I washed my hands, was careful about what I touched, who I was proximate to, I never went 1 year without catching the cold. It's because I lived in a building which was designed for approximately 400 people, but housed nearly 800. We shared 18 shower heads and 12 payphones. The building was poorly ventilated. We lived in close quarters. The windows are welded shut. The cells have bars instead of doors. These cells are 4 feet wide and about 9 feet in length and have 2 people living in them. As we speak, all of the Bay Area is experiencing a surge in coronaviruses. And inside San Quentin, the fastest growing surge has grown to over 1,100 already. When I speak to my loved ones on the inside, I hear physical distancing is impossible. The medical alarms are going off every 10 minutes. People, including hospital workers who are cleaning COVID-infected cells, are being denied showers. They have not been issued hand sanitizer since March. Medical staff refuses to give them any updates on the outbreak, and they are scared. They say moving them from one highly overcrowded prison to another is not the answer. The only safe, responsible solution is large-scale releases. But in spite of reports to the contrary, releases have actually slowed down. Since beginning a modified program in March, earning time off of prison sentences through rehabilitative programming has been halted. In preparing these remarks, I have not been able to stop thinking about my friend Freddie Cole. He's 79 years old, and there were times in 2019 we didn't think he'd survive the year because he'd had open heart surgery and his meds were adjusted several times. I never once heard him complain, but when I spoke to him in the beginning of June, just as the outbreak was beginning, I heard terror in his voice. My dear friend, Daryl Galt, 66, found out earlier this year that his cancer has returned and he will likely not live out the year. This week, I found out he was one of the many who tested positive. I'm thinking of Lonnie Morris, 68, a friend who has mentored hundreds of others, both incarcerated and staff in his 42 years in prison. He created self-help programming that has prepared thousands of people for release. And I'm thinking of Patricia Wright at CIW, who's 69 and in chemotherapy with less than 6 months to live also. I say, with all due respect, that none of these individuals I'm naming, who are all serving sentences for violent felonies, are a threat to public safety today. And each of these people, like scores of others we hear from, have families they can return to immediately. In response to the outbreak, San Quentin has moved hundreds of people to the whole or an outside hospital. And the families of Tommy Wickard, Demetrius McGee, Juan Carlos Mesa, Miguel Cifuentes, and too many others do not know their status or exact location. When families try to get information on the health status of their loved one, staff is not returning emails or answering phone calls. From people inside, I hear that placing them in the hole for being sick is not the answer. When they are moved, their property is placed in storage and they're given a sheet, a blanket, and a bar of soap. The cells they are being placed in are dirty, and in their rush to pack everything up, guards are losing what few family mementos and personal items people inside are allowed. And I appreciate this committee's highlighting of CDCR's continued partnership with ICE. CDCR is the primary source of new bookings for ICE facilities, where 1 in 3 people tested by ICE have been found positive for the virus. At San Quentin, one of the worst outbreaks is occurring on death row, where family members of loved ones sounded the alarm at a recent town hall. Sanitation is not being properly attended to, and staff were working overtime in their area after working other sections of the prison. It's heartbreaking. And the response is to set up 6 tents and create a modest plan to release people, not based upon who is most vulnerable, It's not based upon prioritizing the elderly. It's not even based upon the CDCR's comprehensive risk assessment of who is least likely to commit violence or recidivate. Instead, they have a plan that's based upon the crime a person committed, even if it were 20, 30, or 40 years ago, and the fact that a person happens to have a release date soon. It's obvious that the CDCR does not understand the real threat here. I was excited that Senator McGuire is convening an all-hands-on-deck meeting tonight, and I want to offer myself as well as other advocates as a resource to share reentry resources. I would love to attend tonight. I'm thankful Secretary Diaz has created a new unified command center, and I would refer to that team the June 15 urgent memo by Berkeley health officials that said if the incarceration numbers at San Quentin are not reduced by at least 50%, the outbreak will overwhelm the entire Bay Area. This outbreak at San Quentin, like the ones at Corcoran, CIW, and CCC, are attributed to human error. But those of us who have spent time at San Quentin know the outbreak was inevitable because the CDCR's COVID response plan is insufficient and fundamentally flawed. Until we come to terms with the fact that large-scale releases are necessary for the safety, not just of those inside, but the entire state, this problem will not go away, and both incarcerated and non-incarcerated people will die. Thank you.
Mr. King, thank you very much for your heartfelt and accurate remarks.